I will not want to. I will want to first, before I make any comment, we have a technical advisory committee and Government of India. So we will look into all the aspects. Then we will react on that, because I cannot say by what you are saying and make a remark. No, let us see what is official. This thing that WHO is saying. Yesterday and day before yesterday morning's meeting with the central minister, there was no such concern that was expressed. Yeah. See, at all the aspects, what the technical advisory committee is saying, what are the latest reports that are coming, because now we're going to ramp up testing. So by Saturday we'll be doing, going to reach almost 5,000 is what our target is by Saturday and Sunday. So then we will also get new information, new feedback. So that has to be discussed. And what protocols we have to follow in the future, and all those things will be, on a regular basis. We need to keep updated and take decisions based upon the inputs. No. See, as of now, there is no restrictions on movement, on stay, on travel, on functions, programs. No restrictions are there. Like we've already said earlier, also, people above 60 should be more cautious, and preferably they should wear masks. And especially when you're in crowded places, it's preferable that you wear masks. And these are the general, and keep your hands clean, sanitized as far as possible. These are the general instructions we've given. So it's better to take precautions, because the coronavirus which is there, definitely it will spread amongst the population. But the impact of it is, so far what we've seen and heard, that it doesn't have any very severe impact on the health. So the risk is low risk is there. So you should not panic and should not make it into a situation where you're worried to step out of the house or go anywhere, meet somebody, or go to any films or restaurants or whatever. No such restrictions will be there. No, vaccinations, we have got some stock, but vaccinations will be again decided once with the technical advisory committee, because most of the people are already vaccinated. Maybe some people who are unvaccinated, what to do for them. So those decisions we will take. But CM has said, if that is required also, you should be very ready. That's what CM is saying. In case someone requires vaccination, then we should be prepared for that, is what Chief Minister has said. See, its awareness is there. Media is also, every day you are putting it out everywhere, on TV, on paper. So that is good, because people should be aware. And this, I think, information will go everywhere. And we've instructed our health workers also on all hospitals to be extra careful and mandatorily wear masks for health professionals. No, right now there is no compulsory, but we are advising everybody, preferably you wear. Especially people who are aged, and people when you are going in crowded places, or people who have got comorbidities.
So how has surveillance been increased in border areas, sir?
Surveillance we've told them to increase the tests there in the border areas. Specifically more there, and across the state we will be doing. But border areas to keep a lookout on symptoms, flus, and number of cases that are coming in. So that way we're keeping it active, but we're not screening the people. No screening of population is going to happen. Not yet, at least. No. Right now, no restrictions. That is to be an advisory which Government of India has to put out. Right now, yesterday also I specifically asked the minister, should we do anything about international travelers and our border areas? So they didn't make any comment. They just left it saying that right now all those things are not in the picture. So that is the way they have suggested. No, it's good, because they'll be going in buses and in vans, and it's a bit crowded there. So children, it's good if they do that. And I think that's the advisory we're giving. If you're in crowded places, it's better to be advising them to wear masks. Because not only COVID, there are a lot of influenza-like illnesses, a lot of respiratory illnesses. So it will help them across all these viral infections.